Good evening. My name is Ethelredda Beiti. I'm OUM students year 2 semester 1 for this year with the matrix number 900-106-125148-001 with the subject Nbbs 3303 Communication and Counseling for Nurses. My topic for today is application of therapeutic communication and counseling skills in healthcare. This topic is very important for us as the healthcare industry. The significance of therapeutic communications and counseling competencies in healthcare, and as part in making patients safer, getting them to stick to their treatment, and making their experience better. According to Pavlova 2024, therapeutic communication in healthcare encompasses a comprehensive approach centered on patient care, integrating emotional and informational elements. Moreover, therapeutic communication and counseling abilities are essential for augmenting healthcare safety, fostering treatment adherence, and boosting the overall patient experience. These abilities help healthcare workers and patients trust each other, understand each other, and be open with each other, which it will make it easier to deal with physical and emotional problems. How can therapeutic communication and counseling skills be applied effectively? First of all is building trust and rapport. And of course, under this, we need to have a therapeutic communication and also application to safety. Therapeutic communication is very important for creating trust between doctors, nurses, and patients. It involves listening carefully, keeping eye contact, and speaking in a calm voice. This creates a non-judgmental space where patients may freely talk about their worries, any worries they're facing, and medical history, which leads to better decision making, and will feel more comfortable and calm during talking to us, the healthcare worker. According to Jung et al. 2024, medical communication should respect patients' preferences and values, but patient-centered communication also increases patient participation in decision making, which boosts patient trust. According to Hammett et al. 2025, patient satisfaction with the quality of care is more influenced by effective communication techniques such as emotional expression, interpersonal control, and interpretability than by simply trusting medical professionals' medical knowledge. What is application to safety? When patients feel safe and heard, they are more likely to disclose important health information. For example, they will be more open-minded for us. This transparency enables the early identification and appropriate mitigation of potential safety hazards, particularly those related to medication adverse effects or challenges in adhering to treatment regimens. According to Sun et al. 2022, while trust boosts satisfaction and willingness to divulge information, privacy concerns lower satisfaction. And according to Liu et al. 2022, the development of trust in doctors is positively impacted by patient self-disclosure, with doctor social support serving as a mediator. Move on to the second one is promoting understanding and educating the patient. And of course, the first one is counseling skills, and the other one is application to treatment adherence. What about counseling skills? Counseling skills emphasize how important it is to communicate clearly while informing patients about their diagnosis and course of therapy. And of course, we need to inform them about the whole treatment process too. To make sure that patients understand the disease and the treatment plan, healthcare professionals should use written information, visual aids, and simple language. Avoid using any medical terms because most of our patients do not understand the medical term unless our patients are in the medical field. In medical practice, counseling skills focus heavily on clear, patient-centered communication so that patients can genuinely understand their diagnosis and treatment and participate in decisions. Research supports using a simple language plus well-designed written and visual materials to improve comprehension, trust, and adherence. According to Ball and Khanna 2021, by dispelling misconceptions, fostering trust through thorough medical legal documentation, and lowering treatment-related anxiety, effective patient counseling benefits both patients and healthcare providers. Application to treatment adherence. Patients are more likely to follow the recommended course of action when they comprehend the necessity and advantages of treatment. Their commitment to treatment can be strengthened, for example, by going over the repercussions of not taking their medication as prescribed or missing follow-up sessions. For example, suppose a doctor is communicating to a diabetic patient the dangers of not adhering to their medication regimen. They might emphasize that elevated blood sugar over time can result in complications like nerve damage or secondary kidney conditions or declining vision. This aids in helping the patient grasp the necessity of adhering to the treatment regimen. The doctor might also talk about the benefits, improve overall health, fewer risk of complication, and living longer with a better quality of life. This method makes it even more likely the patient will remain adherent to their treatment regimen. Move on to the third one is addressing emotional and psychological needs. And of course, under this is application to patient experience and also therapeutic communication. Okay, what is applications to patient experience? Okay, addressing emotional needs in healthcare improves the patient experience by making them feel less helpless. Empathetic communication can help and clear up any questions, especially for patients who are very nervous before surgery. I can tell that most of all the patients will be very nervous if they are going to the surgery, whatever surgery it is. This can make them feel better and more confident in their care. For example, before a surgery, a nurse may come sit with the patient and explain the procedure. Am I right? This is following by the step by step in a way that recognizes that the patient may feel fear. The nurse can say, I understand you might be nervous, but I want you to know we'll walk with you through this process. We'll ensure that you're comfortable, and if you have any question in the process at all, don't hesitate to speak up. You're in good hands. This kind of empathetic communication allows the patient to feel more comfortable, takes solace and confidence about their upcoming surgery, mitigates feelings of helplessness while increasing trust in their medical team. What about therapeutic communication? Healthcare professionals need to understand how sickness affects individuals emotionally and psychologically. Patients can express their emotions and worries by using counseling techniques, including empathy, validation, and open-ended questioning. I'm sure all the patients will have a lot of questions in their mind too. In order to reassure and comfort patients, healthcare professionals must acknowledge their worries, anxiety, and frustrations. According to Al-Zahrani 2021, hospitalization has a negative influence on adult patients' emotional well-being, raising feelings of depression and anxiety. Recognizing these findings might benefit patients during their stay at the hospital. The number four is encouraging collaboration and empowerment. And of course, therapeutic communication is under this, and also application to treatment adherence and safety. Therapeutic communication. It is about giving patients power by letting them make decisions about their care through shared decision making. This means showing them all of the treatment alternatives while also respecting their beliefs and preferences. As we all know, we live in a different culture in this world, and they have their own beliefs and preferences too. For example, a doctor discussing treatment options with a patient diagnosed with hypertension could say, there are a few different approaches we can take to manage your blood pressure. One option is medication, while another is lifestyle changes like improving diet and exercise. I'd like to know your thoughts on each option, and we can decide together what works best for you. Keeping in mind what you value most in the terms of treatment. Okay, this approach respects the patient's preferences and beliefs, allowing them to be part of the decision-making process and empowering them to be choose to the treatment plan they feel most comfortable with it. What is application to treatment adherence and safety? Patients are more likely to stick to their prescribed courses of therapy when they are actively involved in the treatment's regimens. This leads to improved health outcomes. Patients will feel more in charge of their health when they are involved in decisions about pain treatment and rehabilitation. And we should not ignore patients in end of decision making because we need to have decision between healthcare professionals and patients. For example, a physical therapist working with a patient recovering from knee surgery might say, we have a few different rehabilitation exercises to help strengthen your knee. I'd like you to try this and let me know which one feels the most effective for you. If you experience any discomfort, we can adjust the intensity together. By involving the patient in the process, offering them choices, and empowering them to take an active role, the patient is more likely to stick with the prescribed exercise and feel more confident about their recovery, leading to better overall health outcomes. Number five is managing difficult situation. And of course, it is about counseling skills and also applications to patient's experience. Okay, first of all is of course by counseling skills. Healthcare providers can help when patients are resistant or confused about their therapy by using successful counseling approaches like reflective listening, reframing, and non-confrontational communication. Okay, for example, if a patient doesn't want to take medicine because of a bad experience in the past, the physician should listen carefully and help the patient think about their options or ease their worries. We need to come up with our way how do we going to talk to patient about what is the importance of the medicine if the patient do not take the medication that already had been prescribed because it is very dangerously if patients with a bad experience the past and if they don't want to eat the medication it's very dangerous because of the medication is very important for them and we need to help we need as a healthcare worker we need to be very careful to this and slowly talk to them and heard what they want to trying to say to us and come up with a creative solution and what is the important and what is the good way for them to think about the importance of the medication if they don't take and try to ease their worries also. And for that, I'm sure that patients will slowly understand about the importance of medications and the past of the bad experiences might not happen in the future again. What is application to patient experience? Good management of tough situation in healthcare may keep patients trust. With this, we need to gain trust from our patients, cut down on the frustration and make the whole treatment process better. What we mean about this is healthcare professionals need to come up with a very good and effective management to treat our patients. For example, if a patient experiences a delay in their surgery due to unforeseen complications, a compassionate and transparent approach from the healthcare team can maintain the patient's trust. A doctor or nurse might say, I understand this is frustrating and I apologize for the delay. We're making sure that everything is in place to provide you with the best care possible, and I will keep you updated of any changes. Your well-being is our top priority. By acknowledging the patient's feeling and offering clear communication, the healthcare team can reduce frustration, maintain trust, and make the overall experience smoother for the patient. Last but not least is ensuring follow-up and continuity of care. And of course, under this is the therapeutic communication and also application to safety and treatment adherence. Therapeutic communication is to provide follow-up care which includes making appointments for the patients, outlining the next steps in the treatment plans, and answering any unanswered questions from the patients. Continuous contact is essential. This is very important for us to follow up our patients because the treatment is continuously and we need to contact them for the next follow-up too. For example, after a patient undergoes surgeries, a nurse might call them a few days later to check on their recovery. The nurse could say, "Hi, this is Nurse Sarah from your surgical team. I just wanted to follow up and make sure you're healing well. How are you feeling? If you have any concern or questions about your recovery or medications, I'm here to help. Also, I've scheduled your next follow-up appointment for next Wednesday at 10 a.m. Just let me know if you need to reschedule." This proactive follow-up provides the patients with the necessary support, clarifies the next steps in the treatment, and helps them feel cared of throughout their recovery process. Okay, what about the applications to safety treatment adherence? All right, they are very trained to give clear instructions on both follow-up care and changes in medications or any lifestyle modifications so that their patients will comply with their treatment better. The more effectively healthcare providers communicate and the importance of taking these steps, and also encouraging patients to ask questions. Of course, when we encourage patients to ask questions, we must give the answers clearly for them. The more misunderstanding and missed opportunities for care will be avoided, and greater safety and compliance with treatment will be achieved. In my conclusion, using therapeutic communication and counseling skills when talking to patients create a supportive environment that make patients safer, more likely to follow their treatment plan and have a better overall experience. In patient-centered care, good communication is very important because it has a big effect on health outcomes during the treatment process. These are my references. Great communication begins with connection. That's all from me. Thank you for lending your ears.